So I've spent the last 25 years trying to understand the shoulder, work on shoulder injuries, fix shoulder injuries, and I would tell you it's probably the most truly amazing joint in the body, because if you look at it, it should not be stable. If you look at this simple diagram, right? If you look at, this is looking at the shoulder from the front. This is the scapula bone. It makes up the socket. This is a humerus bone. That's where the rotator cuff attaches. The rotator cuff is 4 muscles. If you look at this model, rotator cuff, there's one rotator cuff in the front, helps you pull your arm in. There's one rotator cuff on the top, it helps you raise your arm up. And there are 2 rotator cuffs on the back that help push your arm out. But the whole rotator cuff function is to hold the socket solid, and it adds for a fulcrum for you to be able to raise your arm up. And the problem is, as we age or as we have injuries, this is the humerus, this is the rotator cuff. The acromion bone makes up the roof. In between those is a bursa, or fluid-filled sac. The bursa gets inflamed, bursitis. Tendon gets inflamed, tendonitis. And eventually you get breakdown or tearing of the rotator cuff. So you can imagine if one of these tendons gets torn, then your function is going to be weak with overhead, with trying to do overhead stuff. So sometimes that requires to treat the inflammation, injections and medications. Most of the time it requires physical therapy. And if it's a full thickness tear, you have failed conservative measures, then a lot of times that requires surgery.